Good morning, everybody. I've had a little bit of a delay. For some reason, Facebook is delaying pulling things up this morning. I'm not sure why. At least on my laptop. So, after telling you I wasn't going to talk about coronavirus today, I'm going to do it anyway. So, a couple, 3 minutes late, Facebook glitches. I forgot to turn my microphone on. So, if I blipped on and off, that's why. So first off, good morning from beautiful downtown Boonville, Missouri. It is the 3-year anniversary of the total eclipse, which we had a total eclipse in Boonville. We had almost the perfect viewing 3 years ago today. The other thing I want to tell you, I saw a video of Matthew McConaughey interviewing Dr. Anthony Fauci about 2 days ago. If I can find it, I'll put it up later. But I told Sarah, I said, I think Matthew McConaughey must be watching my Facebook Live broadcast and copying my hairstyle. He and I have the same hairstyle right now. Almost the same glasses, not quite. So anyway, what we're going to talk about today is, I keep talking about going back to school, teachers, students, staff, and all that, what you can do, what can be done to protect yourselves. And I keep bringing up vitamin D, and I haven't really fleshed that out. And we did, morning Eileen, we did a whole class, can't remember, 3 months ago on the sun, well, it was more than that, 4 months ago on the sunshine hormone and vitamin D. And since then, I've just been mentioning vitamin D as something you should be taking. So we're going to review that in light of this pandemic. And I'm going to tell you some things that you should look out for and some things that you should be eating. Okay, and then we'll talk about if you get too much, because you can take too much. Okay, so those that are at risk, there's signs and symptoms of vitamin D deficiency, and we talked about higher risks of cancer, higher risks of heart disease, more depressed affect, as well as higher risk of upper respiratory infections. And of course, this virus starts out as a respiratory issue. Okay, also a higher risk of death from all causes with people having vitamin D levels less than 30, and I think at least 50% do. When I have people do their vitamin D, probably 90% are under 30. So the idea is, we'll talk about ideal and optimal levels. So the common risk factors for vitamin D deficiency, and remember, deficiency and insufficient are two different things by the diagnostic criteria. So deficiency of vitamin D is a level of less than 20. And insufficiency is a level from 20 to 29. 30 is considered normal, although it's like at the very low end of normal. So here's the common risk factors: having dark skin, being older, elderly, and I don't really know the exact definition of elderly, since I probably need it. Being overweight, because you just can't get the conversion and synthesis from ultraviolet light from the sun if you're overweight, and you get a lot of peripheral subcutaneous fat. Not eating much fish or dairy, and we'll talk about the differences there. Living near the equator, which none of you that I think watch this are near the equator, although who knows, I never know exactly who's watching and how many until they get off of here, and then it builds after that. And then using sunscreen, we've been told that for 50 years, use your sunscreen, SPF 50, blah blah. Well, eventually that's kind of a problem without you getting any synthesis of vitamin D from the sun. And then staying indoors. People stay indoors a lot. Okay, so what about coronavirus and vitamin D? Okay, so people are talking, right? And we kind of need to separate the myths from the facts. So people, I'm telling you vitamin D. Noel Williams, my partner in Oklahoma, my old ex-partner, I won't say old, he's younger than me. My ex-partner in Oklahoma City has been preaching vitamin D 5,000 units for probably 5, maybe 6 months. So there's, So let's talk about myths versus facts. So a study on the coronavirus and vitamin D published in May in the Irish Medical Journal concluded there may be a role for vitamin D in COVID-19, and here's why. So they gathered data from the World Health Organization to compare blood levels of vitamin D to rates of COVID-19 infection or death in Europe, several different countries. So people in Spain and northern Italy, they tend to have lower vitamin D levels and higher COVID-19 infection rates. If you remember the rates from Italy in I think April and May. And why Italians have lower vitamin D levels? Because it's a fairly sunny place. At least when I was there, it was sunny and hot. Of course, it was August. And then in Norway, Finland, and Sweden, you had the opposite. So those people had higher vitamin D levels. Nobody knows what the actual level of vitamin D that would be optimal for protection and boosting the immunity against COVID-19. But those three countries had lower COVID-19 rates. So overall, the association between vitamin D and COVID-19 was statistically significant. You know that statistics, lies to analyze and statistics per Mark Twain. So does that mean that vitamin D prevents COVID infections? It does not. That's a myth. Does it mean vitamin D prevents COVID deaths? It does not. The idea is to boost your immunity and potentially protect yourself from active infection. You're almost assuredly going to get exposed to this virus. Okay? So, hey, all of you all that join. I wish, it's amazing how many people watch these and don't comment, so I don't know if they're there until I get off. So I can't see a live running number. Okay, so this type of study that they did in Ireland, it can show association between vitamin D and coronavirus, but it can't prove it can't prove causation. So you can't say that low vitamin D causes COVID-19. You also can't say that vitamin D prevents COVID infection or COVID deaths. However, from the research on vitamin D, it's been proven the benefits of vitamin D, and one of them is improving your immunity. So lots of people are getting excited about the possibility that vitamin D may offer some protection. So there's some reasons that makes sense. So vitamin D receptors are present on the T and B immune cells. We talked about the T natural killer cells and the T lymphocytes and B lymphocytes that are the first immune response to a COVID-19 replication in cells in the alveoli, in the respiratory tract cells. Okay, so vitamin D also regulates the cytokine response, and remember the cytokine response is what causes this significant fulminant respiratory distress of COVID-19. If it gets too high, we talked about that as well. So the cytokine storm is what really makes you sick. But vitamin D is a regulator for cytokines in the immune system. Okay, vitamin D supplements reduce the risk of acute respiratory infections. I say respiratory and respiratory, Missouri twang. And then higher vitamin D levels reduce the risk of pneumonia. Okay, and then vitamin D reduces lung injury, at least in mice, and proven this in humans, by blocking pathways involved in COVID-19. So there's no randomized controlled placebo, blah, blah, vitamin D and coronavirus. So we just don't know. But we do know what the benefits of vitamin D are. So what you do is follow the guidelines for optimizing your blood levels, and we'll talk about that, and then consider a vitamin D supplement. So the ideal vitamin D level from age management research, you're going to hear it a million times when I talk about vitamin D, appears to be 65 nanograms per milliliter. The normal range, which is the bell curve, is 30 to 100. So that means that 95% or the 95% confidence interval for a vitamin D level is 30 to 100. So only 2.5% of us are less than 30, ideally, and 2.5% are greater than 100. And we're going to talk about what that means. In reality, and maybe I'm sure that my population is skewed, the people that I test, like I said, that I've tested over the years, 90% of them are under 30. So that doesn't really fit the 2.5 percentile that's under 30 by a Gaussian distribution curve. And then most people say that at least 50% of Americans are vitamin D deficient, so that'd be under 20. So I always say everything follows a bell curve, right? Well, that's the ideal out of my human physiology textbook and all my medical textbooks. I will tell you, in every lab I've ever seen, they are going to give you a bell curve of vitamin D from 30 to 100. Okay? So a level less than 30 is associated, like I said, with increased risk of heart disease and cancer, depressed mood, it decreases your immunity, and you have a higher risk of death from all causes just from a vitamin D level less than 30. That's how important it is. So it becomes evident that knowing your vitamin D level helps you plan to get your level over 50. So that is when you see an orthopedic surgeon or nurse practitioner, they're going to tell you, make sure that you keep, especially as you get older, keep your vitamin D level over 50. Okay? So if your doctor will order you the test, you find out what your vitamin D level is and act accordingly. If they won't do it, there's direct access labs that will do it. You just order the test and they send you the kit. You get somebody to draw your blood and centrifuge it and send it in. So vitamin D is made by exposure to sunlight. So generally it's recommended that people get 15 minutes of exposure to the sun each day. However, the people that I've treated and consulted with and health coached, even the ones that are tan, I've seen some of the lowest vitamin D levels I've ever seen on people that are tan. So they're out in the sun a lot. Okay, so there's, even people that spend a large amount of time outside for work or whatever, farmers, if you measure them, they're less than 30. So kind of you want to know that if you're a person that wants to live a long and healthy life, correct? The recommended daily value of intake of vitamin D is 800 international units a day. Most researchers recommend an intake of 4,000 international units a day as a supplement in addition to your diet. So you can get and we'll talk about diet and vitamin D. So most of the time, most people should or are recommended to take a vitamin D supplement. During the COVID-19 pandemic, the recommendation has been 5,000 international units. That's 125 micrograms daily. You can find it anywhere. It's not expensive. You probably want a pharmaceutical grade vitamin D. So if you buy your vitamin D, like your CBD, at the gas station, you might not be getting the best bang for your buck, even though it's cheap. Okay, so there's plenty of vitamin D rich foods that can improve your levels. Here's the top 7. Salmon. Okay, I love salmon. Not everybody likes salmon, and some people will only eat certain kinds of salmon. So wild salmon has 988 international units of vitamin D per 100 grams, so 3.5 ounces of salmon. Okay, farmed salmon, which I'll bet you is what most people eat, is 250 international units per 100 grams. Okay, so the wild salmon has almost 4 times the vitamin D in it per 100 grams. The next one is herring and sardines. Now, I happen to like sardines. Most people, I'll bet, don't. So fresh herring is at 216 international units of vitamin D per 100 grams. And if you don't like fresh fish, pickled herring comes in at 112. So that's when we tell people, you should eat fish in your diet 3 times a week. That's one of the reasons is vitamin D. The other is omega-3 fatty acids. But not everybody likes seafood. I think I'm guessing people live near the coast do. People that don't. That's fair, probably. Okay, cod liver oil. So if you don't like to eat fish, you can take cod liver oil, or you can take omega-3s. Cod liver oil, though, it's a supplement that serves as a good dose of vitamin D as well as vitamin A and omega-3 fatty acids. It's got a huge amount of vitamin A in it for 1 teaspoon, and if you take too much, you can get too much vitamin A, which can actually lead to some difficult health issues and toxicities. So you got to be careful with cod liver oil. You just don't drink, glug it down. Canned tuna. Okay, so a lot of people won't eat canned tuna because of the methylmercury that's in it. It can build up in your body and cause health problems. However, it's considered safe, even with the methylmercury in it, at about 7 ounces a week. So canned tuna is 268 international units of vitamin D per 100 grams. Okay, a better choice is light tuna. Okay, and again, 7 ounces a week will boost your vitamin D, keep you from getting mercury poisoning. You also get some niacin and vitamin K. So vitamin D and vitamin K and the clotting cascade are important to each other. So there are supplements that have vitamin D and vitamin K in them. I'm looking at one right now, sitting on the table. Whole eggs. Okay, so whole eggs. The white part is the protein part of the egg, and then the yolk provides the healthy fats, the vitamins, and minerals. And pasture-raised chickens produce eggs that are 3 to 4 times the vitamin D than a typical egg that provides about 37 international units of vitamin D. So you're getting up around 100 with a pasture-raised chicken. So fortunately, I know 2 or 3 people that pasture-raised chickens, and that's the eggs. So we buy eggs from them. So, and I'm not the only one. Plenty of people think that eggs are nature's perfect food. Okay, eggs are not bad for you. Eggs got a bad rap from all that research on cholesterol and all that we talked about. Okay, next is mushrooms. Okay, so mushrooms make and synthesize vitamin D when exposed to sunlight, just like human beings and animals. It's a different vitamin D, though. It's D2. And D2, and animals make D3, and the recommended supplement is vitamin D3. So vitamin D2 can raise blood levels of vitamin D, but vitamin D raise levels of total vitamin D. Vitamin D3 does it better. So wild mushrooms can provide, get this, 2,300 international units of vitamin D per 100 grams. Wild mushrooms. Okay, the commercial mushrooms usually or frequently they're grown in the dark, so they don't get that synthesis from the ultraviolet rays of the sun. Some of them are treated with UV light, but they are only 130 to 450 international units per 100 grams compared to wild mushrooms. Okay, and then fortified foods. So some people just don't like fish, or they're vegans. They're devoid of any exposure to animal sources of vitamin D. But there's foods fortified with vitamin D, even though those foods don't really make vitamin D that's nature-based. So the first one everybody thinks of is cow's milk. And of course a vegan would not do that, so they make soy milk, right? So cow's milk has 115 to 130 units of vitamin D per cup. Soy milk, if you're a vegan, this provides 107 to 117 international units per cup. Okay? Orange juice, about 100 international units per cup, and that's with or without vodka. So orange juice is fortified, especially in some other countries where they don't drink milk that much. And then oatmeals and cereals, about 54 to 136 international units per half cup. So oatmeal and cereal. Okay, so vitamin D, we talked about all that. But most people think about vitamin D with bones, and the reason they think about that with bones is because you have to have vitamin D in order to absorb calcium. And the point of that is to maintain the integrity and health of your bones. So from the growth spurt ages of 9 to 18, children usually need about 3,000 milligrams of calcium a day, dropping to 2,500 milligrams per day in adults. Most people recommend women over 30 supplement their dietary calcium with 600 milligrams a day, and then upping that to 1,200 milligrams a day. The orthopedic people will tell you this. Once you're about 50, so 1,200 milligrams a day, because once you become menopausal, you get resorption, or it's called increased osteoclastic activity, breakdown of bone, and that has to do with parathyroid hormone and calcium and vitamin D. But estrogen receptors on bone keep bones healthy. So once you lose your estrogen at menopause, the calcium and the vitamin D intake is important. So basically, that's the main summary of why we keep talking about vitamin D during this pandemic, because I think most Americans are vitamin D insufficient at least, and the little value that everybody says is in Americans is about 50%. Okay, does it prevent COVID-19? No. Will it maybe keep you and protect you from getting an actual acute infection? Maybe. Will it prevent you from dying if you get it? Can't say that. But especially during this viral outbreak, you should spend some time in the sun, get outside. That's not always possible for everybody. Plus, some people don't like sun. Depending on the part of the year, I'm kind of one of them. You can get vitamin D from your diet, but probably not enough to achieve an optimal vitamin D level of over 50. And then eating those foods that are rich in vitamin D that we talked about can help push you toward that goal. But still, a 5,000 unit international unit supplement of vitamin D seems to be a good idea. And I'm not the only one saying it. Okay, so can you get too much? Okay, I've only seen one person, menopausal woman, who had a vitamin D level that was 100. So she was the upper limits of normal. I've seen some people at 99 and 96, this kind of thing. But really, you want to elevate your levels to boost your immunity and protect you from osteoporosis and cancer and heart disease. But there is no agreement on the optimal range. I'm telling you what the age management and functional medicine people say. I think it's Sandy Patty, P-A-T-I. She's an Indian functional medicine physician from Florida. She's the one where I got that number. I don't know if she did the study, but I remember that when she gave a whole hour lecture on vitamin D. Okay, so it is rare to find somebody who has a high blood level of vitamin D. So in a study of 20,000 people over 10 years, only 37 people had a vitamin D level over 100. There was one person that had toxicity levels, and that person was at 364. Okay, so you can also raise your calcium levels too high, and if you get too much calcium in your bloodstream, so a calcium level is also important. A lot of women are calcium deficient, and it's a real narrow window. Calcium normal range is 8.5 to 10.2 on the milligram per deciliter scale. But symptoms of high blood calcium is digestive distress, nausea, vomiting, stomach pain, fatigue, dizziness, confusion, excessive thirst, frequent urination. So it's kind of important, if you're going to take a significant amount of vitamin D, to know your calcium level. Some people take 50,000 units once a week. That's a prescription level vitamin D. You can get vitamin D levels you can get vitamin D as an injection. It's way more expensive that way, but you get it directly in your bloodstream. You know me and shots. I love a shot. So 50, and some people will take that 50,000 and they'll do it once a day. That's probably too much. So 50,000 a week. If I told you to take 5,000 a day, that's 25,000 units a week. And then people that are under 30 or right around 30, 10,000 units a day for about 3 months, then you back off. Once you get the vitamin D level up around 50 to 70, you back off to 5,000 units a day. So I've met one woman, or took care of a woman in oklahoma City, that no matter, I gave her 150 50,000 units of vitamin D a week, and I got her vitamin D level from 11 to 37. That was the best we could do. So some, you got to measure. You got to just check, right? Too much vitamin D will get you nauseous and vomiting. You get poor appetite. You lose you lose your kind of reason to eat, sort of. Stomach pain, constipation, diarrhea, and paradoxically, if you take too much vitamin D, you can get bone loss and osteoporosis, and that's attributed to high calcium levels. Okay, so vitamin K's function is to keep calcium in the bones and out of the blood. So very high vitamin D levels can decrease your vitamin K levels. Okay, so that is what I got for this morning. 28 minutes, oh actually less than that, 25 minutes. And I sort of promised you on Wednesday I wouldn't talk about COVID, and I kind of didn't. But that's kind of the skinny on vitamin D. I'll come up with something else Monday. But as we get back into school, we're going to, hopefully we're not going to have another big, huge outbreak and all the schools shut down, but it is happening. So the whole point of the last week of lectures and class is for people that are in that situation, and there's lots of teachers and students on it, ways to protect yourself potentially and avoid an acute infection. That's the whole point. Alright? So, I'm going to enjoy this beautiful day. It's 63 degrees. It feels like fall. It's supposed to be 84. And then remember, there are 2 hurricanes coming into the Gulf at the same time. So, next week says no rain. We'll see. Alright? So I'll see you Monday morning at 9:30. School will be in session in Boonville. So I might have to think about the timing on these, because I am on the list for substitute teaching at Boonville High School, which puts me in the building at 7:30. So I may have to change the time on Monday, Wednesday, and Friday, or just let you know in the morning that, okay, I got to get through school, and then we'll do a class. Okay? Alright, peace and health to you all. We had a good discussion on the Outer Floundering podcast last night on sexual dysfunction and sexuality. Very well received. Go back and check it out. A lot of good feedback on that one. So I'll talk to you Monday. Have a great day. See you bye.